Welcome. Today we're diving into aristolochic acid nephropathy, a serious kidney disease caused by exposure to aristolochic acid. We'll explore its origins, how it damages the kidneys, who's at risk, what the symptoms are, how it's diagnosed, and most importantly, what can be done to prevent and manage this condition. Join us as we unravel the complexities of this often overlooked health threat. Aristolochic acid nephropathy, or AN, is caused by exposure to aristolochic acid, a naturally occurring compound found in plants of the Aristolochia family. These plants have been used in traditional medicine, particularly in some Asian countries, often as a component in herbal remedies. The primary culprit is the ingestion of these herbs, mistakenly or intentionally leading to kidney damage. Sometimes, accidental contamination of other herbal products with Aristolochia species can also lead to AN, highlighting the dangers of unregulated herbal medicine. Now let's talk about how aristolochic acid damages the kidneys. Once ingested, aristolochic acid is metabolized in the liver into toxic compounds that are then filtered by the kidneys. These compounds cause direct damage to the tubular cells, the cells that line the tiny tubules within the kidney responsible for reabsorbing essential substances and excreting waste. This damage leads to tubulointerstitial fibrosis, which is scarring of the kidney tissue. Over time, this fibrosis progressively impairs kidney function, eventually leading to end-stage renal disease or kidney failure. A hallmark of AN is also the development of upper urothelial cancer, meaning cancer of the lining of the urinary tract, including the renal pelvis and ureter. Aristolochic acid nephropathy initially gained prominence in Belgium in the early 1990s, when a group of women developed rapidly progressive kidney failure after taking a slimming pill that contained aristolochic acid. This incident triggered wider investigations and a better understanding of the condition. While initially reported most frequently in Europe due to this incident, AN is now recognized worldwide, particularly in regions where traditional medicine using Aristolochia plants is prevalent. Precise prevalence figures are difficult to obtain due to underreporting and diagnostic challenges, but it is considered a significant public health concern in specific populations. The signs and symptoms of aristolochic acid nephropathy can be subtle at first, often developing gradually over time. Early symptoms may include fatigue, nausea, and loss of appetite. As kidney function declines, individuals may experience swelling in the legs, ankles, and feet, known as edema. Changes in urine output, such as producing less urine than usual, can also occur. A key sign is the development of progressive kidney failure. Furthermore, AN is associated with an increased risk of urothelial cancer, so individuals may experience blood in their urine, flank pain, or other urinary symptoms associated with cancer. Diagnosing aristolochic acid nephropathy can be challenging, as the symptoms can mimic other kidney diseases. A thorough medical history, including questions about the use of herbal remedies, is crucial. Blood tests to assess kidney function, such as measuring creatinine and blood urea nitrogen levels, are essential. Urine tests can help detect abnormalities like protein or blood. Kidney biopsy, where a small sample of kidney tissue is examined under a microscope, is often necessary to confirm the diagnosis and look for characteristic features of AN, like the specific type of fibrosis and the presence of aristolochic acid DNA adducts. Imaging studies like ultrasound or CT scans may be used to evaluate the kidneys and urinary tract for any abnormalities or tumors. While AN doesn't have distinct subtypes, the severity and progression can vary significantly among individuals. Factors such as the dose and duration of aristolochic acid exposure, as well as individual susceptibility, can influence the course of the disease. Some individuals may experience rapid progression to kidney failure, while others may have a slower decline in kidney function. The presence of urothelial cancer also adds complexity to the clinical picture. Unfortunately, there's no specific cure for aristolochic acid nephropathy. Treatment focuses on managing the symptoms of kidney disease and preventing further damage. This includes controlling blood pressure, managing fluid balance, and treating anemia, which are common complications of kidney failure. Avoiding further exposure to aristolochic acid is paramount. In advanced cases, dialysis, which filters the blood artificially, or kidney transplantation may be necessary to sustain life. Surveillance for urothelial cancer is also a critical component of management, with regular cystoscopies and imaging studies to detect any tumors early. Prevention is the most effective strategy against aristolochic acid nephropathy. Public education about the dangers of unregulated herbal remedies is essential. Strict regulation and quality control of herbal products are crucial to prevent contamination with Aristolochia species. Healthcare providers should be vigilant in asking patients about their use of herbal medicines and educating them about the potential risks. International collaboration is needed to monitor and control the trade of Aristolochia plants and products containing Aristolochic acid. The prognosis for individuals with Aristolochic acid nephropathy varies depending on the severity of kidney damage and the presence of urothelial cancer. Many individuals with AN progress to end-stage renal disease and require dialysis or kidney transplantation. The risk of developing urothelial cancer remains elevated for many years after exposure to Aristolochic acid, necessitating long-term monitoring. Recent research is focusing on developing more sensitive biomarkers to detect early kidney damage from Aristolochic acid exposure and exploring potential therapeutic targets to prevent or slow the progression of fibrosis. Studies are also investigating the mechanisms by which Aristolochic acid induces urothelial cancer to identify new prevention and treatment strategies. By understanding the disease, we can work towards better outcomes for those affected by this preventable tragedy.